Thank you very much, and hyvää huomenta Lissabonista. I will present in English because the webinar is in English, but I was born in Finland, so I'm a kind of an expat Finn. So I'm very pleased to be part of this webinar today. So distinguished participants and panelists, a very warm welcome and good morning from Lisbon in Portugal. Let me just try to find my slides here. Heikki, can you please confirm you can see them?
I see them. Thanks.
Yes, good. Okay. First of all, on behalf of the European Union Drugs Agency, I would like to thank the organizers for inviting our agency to address the webinar today on this very important topic. I will begin by presenting an overview of the current situation of drug use based on the European Drug Report 2024 Trends and Developments, which is EUDA's latest annual review of Europe's drug situation. And I will then touch briefly on the topic of prevention. So this is our flagship report, the European Drug Report, which is published once a year in June. It is accompanied by what is called the statistical bulletin. So what the report tells us is that the report focuses on illicit drug use, related harms, and drug supply, and is accompanied by the statistical bulletin, which is web-based, where data underlying the analysis can be found. The report, EDR, is available in 25 EU languages in a digital format. The analysis also draws on the EU drug markets analysis report and the European Health and Social Responses Guide and accompanying mini-guides, as they are called. I would briefly like to introduce the European Union Drugs Agency, because this year has been a year of transition. After nearly 3 decades of the European Monitoring Center for Drugs and Drug Addiction, EMCDDA, our previous center transitioned into a fully fledged European Union Drugs Agency on 2nd of July this year. The reason for the change and the transition and a new legal regulation was that the drug phenomena in Europe has changed significantly since the EMCDDA, the monitoring center, was founded. There was a perceived need for providing Europe with greater capacity to respond effectively to a more complex and rapidly changing drug phenomena. The European Union Drugs Agency will support the European Union and its member states by providing services in 4 main areas. First of all, by anticipating new and future challenges, by alerting on emerging risks and drug-related threats, by assessing needs and available health and social responses, and by assisting stakeholders by evaluating and disseminating new knowledge and best practices, including in prevention. In addition, the a new system called European Drug Alert System will be established to complement the existing early warning system, focusing on the new psychoactive substances. And there will be new health and security threat assessments. A whole new mechanism and system is being put into place to provide member states threat assessments. In addition, support will be provided for evaluation and development of evidence-based policies, and the agency will be also better equipped to develop and promote evidence-based interventions and sharing of best practices. In addition, the EUDA will continue to strengthen the RATOX network of national drug focal points and also have a stronger international role and support European Union in drug policy at the multilateral level. So now moving to the overview of the drug situation. This is the screen capture of our website, where you can find the digital European drug report, which in the past used to be a printed version, but now is fully digital. Let me just move my little bar so I can see better the slides. So what the European drug report that was published in June this year, what does it tell us? First of all, the available information suggests that the drug market is characterized by widespread availability of a broader range of drugs than in the past, with substances often available in high potency or purity or in new forms, mixtures and combinations. There is a growing diversity in the forms in which substances can be available on the market. In some cases, such as cannabis, for example, the routes of administration by which they may be consumed, with edibles and various forms of vaping technologies appearing. These developments increase concerns that the risks associated with some substances may be growing. In particular, people who use drugs may be placed at a greater risk of experiencing health problems, including potentially fatal poisoning through consuming, often unknowingly, higher potency or novel substances. Trying to move on to the next slide. It's a little bit slow. There we are. A key message of this year's European drug report is that polydrug use consumption is common among those consuming psychoactive substances, and such polydrug use increases risk of health problems. So what is polydrug use? Let me define it briefly. Polydrug use is the use of two or more substances, licit, meaning legal, or illicit, simultaneously or sequentially. Substances may be sold on the drug market that contain one or more drugs other than the person who was buying the drug was expecting. These drugs may be either in a mixture where they intended to purchase, or as a replacement for it. This means that the consumers, the people who are buying the substance, may be fully unaware of what substance or substances they are taking. And this obviously poses a lot of risks for the user. Polydrug use, using drugs in combination, can increase the risk of health problems and complicate the delivery of effective interventions, which is an issue, for example, when responding to acute poisoning due to drugs. Challenges in this area also appear to be growing, partly due to the increased market integration of established illicit drugs and NPS, the new psychoactive substances, and partly to the wider availability and use of synthetic substances. With the more dynamic and complex drug use patterns, the presence of multiple substances in most opioid deaths deserves more attention. Opioids, usually in combination with other drugs, remain the substances most commonly implicated in drug-induced deaths, and opioids continue to be involved in a large proportion of fatal overdoses. Approximately 75% of all fatal overdoses reported by EU countries. In 2022, where the latest data are available for the EU, there were 6,392 deaths due to drugs. This is a mortality rate of 22.5 deaths per million. Among those were 1,800 deaths due to heroin, and heroin continues to be present in majority of drug-related deaths in some specific countries in the EU. Most deaths are associated with polydrug toxicity, and I understand that this is also the case in Finland. Involving combinations of illicit opioids, other illicit drugs, medicines, and often alcohol. Deaths where stimulants are implicated, often alongside opioids, appear to be rising in some countries. Enrollment in opioid agonist treatment is strongly recommended because it is evidenced as a protective factor against opioid overdoses. Yet, coverage of opioid agonist treatment continues to remain low in many EU member states, even though it has been scientifically demonstrated that OAT, opioid agonist treatment, either with methadone or buprenorphine, is highly effective at reducing health problems and mortality, with 3 to 5 times lower mortality among those on OAT than those not on opioid agonist treatment. The World Health Organization, UNODC, and UNAIDS recommend that at least 40% of opioid-dependent individuals should be covered, should be on an OAT program. So it is a very effective intervention, health intervention that both the European Union Drugs Agency and the UN agencies I mentioned recommend in countries with continuing drug-related deaths due to opioid use. I will now present a brief snapshot of the 4 main substances and the picture in the European Union, and also zooming into the situation in Finland. First of all, cannabis. Cannabis remains by far the most commonly consumed illicit drug in Europe. National surveys of cannabis use indicate that overall, an estimated 8% of European adults used cannabis in the previous year. Last year, cannabis use among EU population aged 15 to 34, which is what you can see on the map on the left-hand side, is estimated to be at about 15%. This translates to 15 million people, with men being typically twice as likely to report use compared to women. Among 15 to 24-year-olds, an estimated 18% or close to 9 million people used cannabis in the previous year. And around 3.7 million people, or 1.3% of the European population of the European Union, adults are estimated to be daily or almost daily users of cannabis. And this is the group, the daily users, the group that is the most likely to experience problems associated with problematic use of cannabis. Moving on to amphetamines, I think what's interesting is that of all the countries where data is available, Finland ranks highest in terms of prevalence of use of cannabis. It's the black bar in the graph on the right-hand side. And I think we can also observe that the prevalence of use of, amphetamines, I don't know if I said cannabis, sorry. So amphetamines ranks, Finland ranks highest in terms of prevalence of use of amphetamines. And you can see in the graph that the prevalence of use of amphetamines started to increase gradually since year 2010. In general, the European picture tells us that surveys conducted by 24 EU countries between 2017 and 2023, these are surveys that group amphetamine and methamphetamine together, suggest that about 1.5 million young adults aged 15 to 34 used amphetamines during the last year. Prevalence of use of amphetamines among 15 to 34-year-olds, you've seen it's really the highest in Finland of all the EU countries where data are available. And what is of concern also is that 7 European cities across 6 countries have reported localized HIV outbreaks associated with injecting of stimulants. Then moving on to cocaine. Cocaine is, after cannabis, the second most commonly used illicit drug in Europe, though the prevalence of use and patterns of use vary considerably between different countries. Again, I think it's important to observe that since 2010, there has been a steady increase in prevalence of use of cocaine in Finland. So there is a notable increase. But cocaine has increasingly become common in many EU countries, so this is not uncommon. I'm conscious of time. Do I have another maybe 10 minutes? Okay, moving on to MDMA, which is a synthetic substance chemically related to amphetamines, but with somewhat different effects. Surveys conducted in 26 EU countries between 2015 and 2023 suggest that about 2.2 million young adults in the 15 to 34-year-old age bracket used MDMA in the last year, and with 1.1 million aged between 15 to 24 having used MDMA in the last year. Again, you can see an increase in prevalence of use of MDMA in Finland starting in 2010. I think I will move on to the next one. A little bit about particularly about a very harmful mode of use of illicit drugs, which is the injecting drug use. I wanted to draw attention to this because Finland has the second highest population prevalence of injecting drug use after Estonia. It's basically the blue square. If you look at Estonia is the highest in terms of population prevalence of injecting drug use, and I've circled Finland, the blue square, because even though the absolute number of people who inject drugs in Finland is, well, it is the fourth or the fifth highest of the EU countries where data are available, the population prevalence of injecting drug use is the highest after Estonia. So I think that is a continuing point of concern, that we should not forget that people who inject drugs are particularly at risk of drug-related infectious diseases such as viral hepatitis, HIV. And you can see on this map on the right-hand side that there has been an HIV outbreak among people who inject drugs in Helsinki. And injecting drug use does continue to be associated with a large proportion of transmission of new cases of viral hepatitis C. Now, moving on to the prevention part of the European Drug Report, as Giovanna Campello from UNODC mentioned, not all prevention approaches are equally effective, and we now have a solid evidence base for what we call evidence-based prevention programs, and Giovanni nicely highlighted some of those prevention interventions and programs that have been found, that are grounded on evidence and that have been found to be effective in preventing initiation of drug use or delay in terms of delaying drug use. What the European Union Drugs Agency has done with support from funding from European Union was to develop what is called the European Prevention Curriculum, or EUPC in short. And this is basically a handbook for policymakers, opinion makers, and decision makers, laying out the science behind prevention of drug use. The objective of the EUPC curriculum is to improve the overall effectiveness of prevention interventions across the European region. 25 EU member states have national EUPC trainers, and as Giovanna mentioned, EUDA also hosts the Exchange Registry, which is an online registry of thoroughly, rigorously evaluated prevention interventions. this is a screenshot of our institutional website where you can actually Google it and you will find it easily. I did a search for, I just put in the keyword Finland and just to see what kinds of prevention programs come up. And there are 3 programs, and a particularly well-known one is the anti-bullying program. Not all the programs that are included in the exchange registry focus on prevention of substance use, but many of them do. In Finland, 3 programs that actually focus on anti-bullying or prevention or delaying of smoking have been found to be either likely to be beneficial or possibly beneficial. So the exchange registry gives us information or examples from other countries and Finland for prevention programs that are likely to be effective. But you need to look at the rating by the committee that basically evaluates and reviews the programs and whether they merit to be included in this registry. There are currently about 22 prevention programs included in the registry, and another several programs that are in a waiting lobby, yet to be reviewed and assessed whether they can be included in the registry. In addition, the European Union Drugs Agency has what we call the best practice portal, and this is the portal of evidence. It's an evidence database, and again, you can search. You can use key search terms for either by type of substance or the desired outcome. And here I just chose from the drop-down menu reduce substance use as the desired outcome. And here you can see some of the evidence summaries and the rating of evidence for different types of programs or interventions. So this is another resource that can be used. They are freely available for anybody to access on our institutional website. The European Prevention Curriculum, EUPC, which I mentioned, has been adapted for use in Finland and translated into Finnish, as you can see. And it is being rolled out in a large number of EU countries and also in the European Neighbourhood Policy area, the broader Europe, including Ukraine, Georgia, and other countries. And I believe Hanna will share us more about the EUPC and how it's being used in Finland. So what is interesting here, you can just see the number of EUPC trainers who have been trained by the EUDA and who are fully accredited, including 2 individuals in Finland, to roll out and make most use of the EUPC training resources and materials. So these national EUPC trainers are accredited and recognized by the European Union Drugs Agency as fully qualified and equipped trainers who can train onwards and roll out the prevention trainings at national level. I'm coming towards the end of my presentation, but I would like to highlight the EU Drugs Strategy and Action Plan for 2021-2025, because for the first time, the EU Drugs Strategy in the point 5.4, it recognizes or draws attention to the European Drug Prevention Quality Standards, the UNODC WHO International Standards on Drug Use Prevention, which Giovanna mentioned or introduced, and the European Prevention Curriculum. The strategy is accompanied by the action plan, and one of the actions, number 30, is basically it calls upon member countries to promote and allocate sufficient funding. And I'm not going to read out everything, but it's really action 30 focuses on the importance of member states in rolling out evidence science-based drug use prevention using the quality standards, the international standards on drug use prevention, and the European Prevention Curriculum. So prevention is one of the many priorities within the EU Drug Strategy and Action Plan. And finally, I would like to mention that different countries they use different prevention approaches. Some of the countries tend to rely heavily on what we call manualized approaches. They use prevention manuals, whilst other countries such as Finland are well known for making use of what we call environmental approaches that reach large numbers of people or the entire population or vulnerable sections of the population through environmental systemic approaches. So I think there is a lot of variation in terms of what kinds of prevention approaches are being implemented in different EU countries, and Finland is particularly well known for the environmental approaches. And I think the anti-bullying program was an example of those. I would like to end my presentation by raising a couple of questions for reflection. And I think it's very important when we all, Heikki mentioned that budget is scarce, resources are scarce. So it's very important to reflect on what kind of prevention program or intervention can be most effective in our country, Finland, and how effective are the programs? Because as Giovanna also mentioned, some programs are more effective than others. For some interventions, there is a solid evidence base, while for other prevention interventions, there is a limited evidence base, no evidence, or even worse, some prevention interventions have been found to be harmful. They do not produce the intended outcomes. So it's very important I believe, for policymakers to review and assess what is the evidence behind each and every program in order to make informed choices about the most effective prevention programs that can contribute or achieve the intended outcomes, meaning prevent particularly young people from starting drug use or delaying initiation of drug use. And then secondly, given the overall situation of drugs in Finland at the moment, with an apparent increase in number of drug-related deaths, I think that there needs to be a public discourse among the policymakers about appropriate balancing and budgeting of prevention, harm reduction, and treatment interventions. So these are just some questions for reflection, and I'm sure our ministerial advisor, Elina Kotavirta, will perhaps touch on some of these. I'm looking forward to hearing her perspectives. And thank you very much, and I hope I didn't go too much over time. Thank you.